Today I'm going to describe to you what a surgical site infection is, or SSI. According to the CDC website 2020, a surgical site infection is an infection that occurs after surgery in the part of the body where the surgery took place. Surgical site infections can sometimes be superficial infections involving only the skin. Other types of surgical site infections are more serious and can involve tissue under the skin, organs, or implanted materials such as total joints, such as knees and hips, ankles, and also it can mean ports, mesh, anything that is foreign body to you. According to Infectious Disease Advisor, a surgical site infection may be caused by endogenous or exogenous microorganisms. Most surgical site infections are caused by endogenous microorganisms present on the patient's skin where the incision is being made. Gram-positive bacteria like Staph aureus is the most common cause of skin-dwelling microorganisms. According also to Infectious Disease Advisors, some factors that play into surgical site infections are someone that is very young, very old, they have diabetes, they have tobacco use, steroid use, they have a compromised immune system, obesity. There are many preventable causes that take place prior to someone going into surgery to help prevent a surgical site infection. According to Infectious Disease Advisor 2020, antibiotic use prior to going into surgery, usually within an hour before the incision is being made. The duration of a surgical scrub is 3 minutes dry time. Perioperative hair removal, which is the hair around the incision that is being made is taking off prior to going back to surgery. Making sure you have the proper ventilation whenever you go back to the OR behind the scenes. What wound class is it? There's 4 different wound classes, 1, 2, 3, and 4. First one means it's clean, and then stage 4 is dirty. If a surgical site infection is dirty, which means puts you at a higher risk for developing a surgical site infection. The duration of the surgery. The less that you are under anesthesia, the better, because the longer you are under helps prevent you developing a surgical site infection. The sterilization of instruments and the environment, how well the OR is cleaned between the procedures after every case is done, how long the instruments are taken to get cleaned, and also to surgical techniques. To make sure your scrub tech, anybody that's in the OR, does the proper handling of everything to keep you at the safest that they can. Another thing that is very important about surgical site infection is from the World Health Organization 2020. Most surgical site infections are preventable through good hand washing. Just anything you can think of, like even washing your hands to prevent germs on your skin, or even after you do anything, you wash your hands. That is the biggest thing you can do, is just wash your hands. The biggest thing someone says too is to sing happy birthday when you wash your hands. But a surgical scrub is more in depth before you go into the OR. The scrub tech scrubs, they do one arm, then they do the other, and when you rinse, you have to make sure the water falls down your elbows and make sure you're not contaminated. Another good thing about surgical site infections, according to the Joint Commission 2020, has developed a new informatic. It takes a team to inform leaders, caregivers, patients, and other ways to help people prevent each other from having surgical site infections. What they usually do too, the Joint Commission comes around and audits the OR and tells them what they can and can't do. And also too, according to ARN 2020, you have to follow by these rules to get money and also to keep the patient safe. So if you don't follow by the Joint Commission standards or ARN guidelines, they do not pay. Another website that I found was interesting was a national healthcare safety network. It gives guidance for also tracking surgical site infections. There's different surgical site infections that you have to track, such as a CAUTI, which is a urinary tract infection. Also, too, there is surgical site infection, which there's more others to get in depth. So the reason that I chose surgical site infections is because I am a registered nurse. I have been a registered nurse for 14 years, and I have worked in the OR. So surgical site infections are very important to me because I am around them. Some of the things that I do personally to keep surgical site infections down is, one thing is you wear goggles. Goggles also protect you and protects the patient. Also, too, is a surgical cap. Whenever you wear a surgical cap, you have to tuck all your hair and keep your ears covered. No jewelry on your hands or anywhere. And also, too, you wear a mask. The OR is the most sterile environment there is. So you have to keep yourself protected from the patient, keep the patient safety first. So surgical site infections are the most preventable cause there is, and I chose this topic to make people aware of surgical site infections and what you can do to help prevent them before you go back to surgery. If you have any questions, please let me know.